And thank you all indeed for coming this morning. I'm Neil Maguire. As Abigail said, I'm a GP, and I, like a large number of family doctors, will be voting no on the 25th of May. The debate around the referendum on the 8th Amendment to our Constitution has been very incomplete, and the government's proposal has been presented in a distinctly misleading way. And today I'd like to talk about one aspect of that mistruth, and that is namely the role of the GP in medical abortion, the prescription of abortion pills, and the wider impact of the proposal on our health services. The public in this referendum have been told that medical abortion under 12 weeks is a simple matter. You make an appointment with your GP, you ask for a prescription, you wait 72 hours, and then you take the tablets. The impression is, by this being given to the public, that this is about regulating something very simple, straightforward and safe. Nothing could be further from the truth. The fact is that our nearest neighbour, Great Britain, 40% of all abortions under 12 weeks, first-term abortions, are actually surgical abortions, where the mother requires a general anaesthetic and the fetus and the rest of the uterine content is evacuated surgically in a hospital. In Ireland, according to what the Minister proposed, this would mean hospital appointments, surgical evacuation of the womb, usually under anaesthetic. Let's look at the British numbers in more detail. At 12 weeks gestation, 83% of all British abortions are actually surgical, not medical. At 11 weeks, that figure is 87%. At 10 weeks, it's 82%. Even at 9 weeks, over half of all abortions are surgical abortions, not medical abortions at all. This reflects the declining effectiveness of the abortion pill as pregnancy progresses. Now, not even looking to the expected explosion in the number of abortions if the repeal vote is carried, just taking the current number of abortions that is proposed by the yes side, that means out of 5,000 abortions in Ireland next year, we can expect to have to provide for 2,000 surgical abortions. So our gynecology and obstetric hospitals are going to have to make provision without any waiting list, because you can't wait for an abortion, for 2,000 additional surgical procedures. And this has been proposed and is to be voted on by the public almost unwittingly, without any consultation with the health professionals who have to deliver the service. Each surgical abortion, remember, will take priority over all other gynecological or obstetric procedures, because you can't have a waiting list for an abortion. There has been no discussion with either in the public sphere or between the government and the representatives of my profession, or as far as I know, the nursing profession. As a GP, my colleagues and I will be expected to provide those remaining medical abortions. This isn't something we were equipped to do, even were we willing to do it. I've heard pro-choice doctors say that they will provide this service, but I have never heard them asked about the fundamental specifics of how it is to be provided. Remember, to effectively gauge gestational age, one needs ultrasound. We don't have ultrasound in general practice in Ireland. We don't have the training or the regulation for ultrasound in general practice in Ireland. These will have to be provided. Giving a woman an abortion pill without an ultrasound, without certainty as to the gestational age, could be highly dangerous. Highly dangerous to her, because it's always lethal to the child. We're being told that this proposal is about the health and safety of women, and yet what is being proposed in this cavalier fashion is explicitly unsafe for women. As doctors, as members of the public, we are being asked once again to trust Minister Harris. He hasn't spoken to us as to what role he expects us to fulfil, and what is more, he has explicitly refused to discuss it until after the referendum is passed, because he doesn't want you to know. And this is just not acceptable. I'm speaking out today because what is being proposed looks as if it's been put down on paper for political expediency, rather than with any scientific medical interest at heart. The question that I'm raising today are very simple questions. They concern many of my colleagues, and the public deserves an answer to them before they vote. I'm voting no, like many other doctors, on May 25th, essentially for two reasons. The first of these, that it's essentially, fundamentally, professionally unreasonable and impossible to ask doctors to add ending lives to the list of their duties. The second is that even were it acceptable, this proposal has all the hallmarks of another botched job by our Department of Health. I look at what's being proposed, and I look at what the health service can provide, and then I see a complete gulf between reality and this proposal. Women and our society deserve far better than this, as do the men and women who work in the health services. You will hear that 1,000 doctors have signed up on the yes side. Well, I'm with the 95% who haven't, and that's why I'm voting no on May 25th. Thank you very much.